Hi, my name is Grant. I'll be your nurse today. Is it okay if I assess the child today, Mom? All right, perfect. I'm just gonna look at the patient's wristband real quick, and it is the right patient. So what I'm gonna do is I'm gonna start with the vital signs. I'm gonna start with heart rate, and then we'll get into respirations. So normal heart rate is 100 to 160. Respirations is typically 30 to 60. And then I'll also be taking the temperature and listening to abdominal sounds just to make sure that they're present. Normal temperature range is 97.7 to 99.4. I'm going to be listening to the heart first. So heart rate was 154, so that's normal. And now I'm just going to listen to the lungs. So respirations were 54, so that's normal. Now I'm just going to listen to the bowel sounds. So bowel sounds are present. Now I'm just going to take temperature. It was 98.4, so that's normal. And now I'm going to start the head to toe assessment. So the hair is intact. I'm looking for any abnormalities such as cephalohematoma, which is one-sided swelling of the head, or caput suicidum, which is full head swelling. I'm checking for jaundice, so I blanch the forehead, chest, leg, and then look at the eyes. Just looking for any yellowness. Hair is intact. Checking the fontanelles and sutures. Ears are midline to eyes. Ear recoil. And then eye to nose is 1/3. Nose to eye is 1/3. There's a little bit of secretions from the eyes, which is normal. Nasal patency, flaring, making sure there's no respiratory distress signs. The 5 would be nasal flaring, grunting, seesaw breathing, chest retractions, or overall color. And now I'm going to don gloves on, and I'm sticking my finger in the cheek and rubbing around, testing the hard and soft palate, but I'm really looking for rooting. And then the baby should be sucking on my finger the whole time. While I'm doing this, I'm taking the gloves off now. And then I'm looking at the neck, assessing range of motion, and also I'm feeling for any masses or abnormalities. So I'm feeling for clavicles now, making sure there's no breakage, because sometimes the baby comes out and the clavicle's broken. So I'm just making sure that these are intact. So clavicles are intact. I'm doing the recoil reflex of the arms. So I lift them up, I drop down, and they should come back up. So that's normal. Looking for creases on the hands. There's 5 fingers on each hand. I'm doing the moral reflex now. He did it. All right. And then nipples are symmetrical, intact. Chest is flat, abdomen's flat. Looking for any roundness in the abdomen as well. Umbilical cord. Looks like it is drying, but it is above the diaper. And I'm doing Babinski now. So the feet flare, that's normal. There's 5 toes on each foot. And then I'm going to flip them over. I'm looking for any abnormal signs of Mongolian spots, stork, any abnormalities. So no bruising, no. There is a little bit of hair, which is normal. Cheek, butt crack is midline. There's no abnormalities there. I'm gonna flip him back over. So since he is a male, I'm gonna test or just look at his genitals. And it looks like both of his balls descended, and there's no redness or inflammation at the circumcision line where he was circumcised. So everything's normal there. I'm gonna pull these back up, and all I'm gonna ask is just the mom a few questions about how's the baby responded to breastfeeding. Has she noticed any differences in maybe wet diapers, stools, or any overall concerns about the patient's well-being and breathing? But other than that, that kind of sums up the assessment.